It's a challenge not just during the summer, but all year round, and especially over the summer. Kids may spend a lot of time watching those screens to occupy themselves.
But health experts say too much screen time can lead to problems. In today's Your Health Minute, Mandy Gaither has tips on how to get their eyes on something else.
From gaming consoles to TVs, smartphones and tablets, children and teens spend a lot of time watching screens.
Most children, school-age children, are spending in excess of 7 hours a day on screens.
Wendy Palmer with Children's Healthcare of Atlanta's Strong for Life says recommended screen times vary based on a child's age. But for those old enough to go to school, less than 2 hours a day is the recommendation.
Screen time, when it is excessive, can impact sleep, it can impact physical activity, and most recently, the clearest evidence is really looking at the impact of excessive screen time on youth mental health.
To limit summer screen time, Palmer says to keep some school year routines in place. Set screen-free zones, especially in bedrooms or on short car rides. Use that time to talk to each other instead. Make a commitment to having no devices at dinner. That goes for parents, too. And she says it's okay for your kids to be bored.
Boredom is a necessary component to kids really learning and adapting and figuring out how else can they entertain themselves.
Palmer says to encourage kids to be active and to play in person with others, whether that's outdoors or inside.
Drawing, thinking about writing, thinking about reading, really encouraging some of those behaviors that our kids may now associate with, well, I go to school and I do those things. Those are certainly opportunities at home.
For Health Minute, I'm Mandy Gaither.
When it comes to screen time for younger kids, the American Academy of Pediatrics recommends children under 18 months should avoid screen time except video chatting, and children between 18 and 24 months should be limited to watching educational programming with a caregiver, and children ages 2 to 5 should be limited to about 1 hour per day.
About 4,000 people drown each year in the U.S. That's according to the Centers for Disease Control and Prevention. And AAA Idaho says drowning is the leading cause of unintentional death between kids ages 1 to 4. So as you hit the water this summer, AAA has some safety tips. Home pools should be covered when not in use and have a fence or barrier around them. Keep children away from the pool filters and other mechanical devices, as well as strong river currents and riptides. Wear a life jacket and watch for dangerous items around the water. Also, keep toys out of the pool so kids don't fall in trying to get them. And finally, make sure you're up to date on CPR and first aid training.
A new study shows teens and young adults who lost significant weight following bariatric surgery had weaker bones afterward. However, researchers say that doesn't mean bariatric surgery should be avoided for youth with severe obesity. A radiology expert says it's still a good idea to get the surgery if needed because diabetes and heart disease are more deadly than osteoporosis. She says the takeaway is those who get the surgery should maintain a healthy diet, do weight-bearing exercise, and get enough vitamin D and calcium.
About 15% of U.S. children were recently treated for mental health disorders. That's according to new research from the CDC. The findings suggest conditions like ADHD or anxiety are common among school-aged children. Most treatments happen among adolescents between 12 and 17 years old. Boys were more likely than girls to have taken prescription medications for their mental health. The percentage of children who received mental health treatment in the past 12 months was also higher in places that were more rural.
Another new report from the CDC finds youth and young adults are dying from suicide and homicide at the highest rate seen in decades. The analysis found in 2021 suicide and homicide were the second and third leading causes of death for children and young adults ages 10 to 24. The homicide rate for the same age group was also the highest since 1997, while the suicide rate was the highest since 1968. Earlier research saw a steady increase in the number of children visiting emergency rooms for suicidal thoughts, and that was before the pandemic. The pandemic also saw a large spike in both homicide and suicide rates.